Hello everyone, welcome back to UWorld's Next Gen NCLEX review. My name is Nicole here with another question drill set. If you're new here, welcome in, glad to have you. If you're new to UWorld, well, welcome in. We do NCLEX review to get you ready for your NCLEX. How a question drill works is I will pull up a question, give you about 30 seconds to review the question, review the answers, and then drop what you think down in the comments. I have the comments in the chat pulled up here, and we can go over why the right answers are right and the wrong answers are wrong, and build a little community here in the comments to kind of figure out how to get around these NCLEX style questions and help each other out, whether it's keywords in the questions or little tid points that we could help each other with different topics and dynamics with the question itself or the topic itself, but just helping each other out. Today's topic is developmental milestones. So all the things from infancy, from to childhood, to all the way to adolescence, the different milestones that children have to meet at certain ages to make sure that they're developing at the correct rate. In the chat, we have Samantha, Nurse Samantha in the chat to moderate. If you have any questions or if I go a little bit too fast, ask her any of the questions that you guys might have. And without further ado, let's get started. So the first question says, the nurse is assessing a 14-week-old client. Which of the following findings would be a priority to follow up? Option 1, a blink reflex. Option 2, tear production occurs with crying. Option 3, eye gaze does not follow head movement. Or option 4, can focus on image 8 to 10 inches away from the eyes. Let me know what you guys think in the chat. Hello, everyone. So it says perfect just in time. Yes, just in time. We just got started. Today's topic again is developmental milestones. So all the things from childhood, adolescence, different milestones that we have to reach. Drop your answers down in the chat. Let me know what you guys think for this first question. Hello, everybody. Welcome in. Welcome in. Lots of people on TikTok this afternoon and on YouTube. Nice to see you guys. We go live multiple times a week on Instagram, TikTok, YouTube, Facebook. Plenty of ways to tap in and get some more NCLEX review at different times, different social media handles with different topics all throughout the week. Good job, guys. This one seems pretty easy and pretty unanimous across the board. It is option 3. That eye gaze does not follow head movement. So priority, meaning that we're looking for an abnormal finding. It's a negative worded question. So that abnormal finding is that eye gaze does not follow head movement with a 14-week-old client. So this is about 3.5 months. So a 3.5-month-old baby, if their eye gaze does not follow their head movement, which means their eyes are looking this way, but their head is like this way, and the child does not track, this would have us think that they are having some neurological problems. This is called the doll eyes reflex. And so if they're still having this after 3 months, we would think that there's some type of neurological deficit happening, and we would need more imaging to figure out what's going on with the brain. Options 1, 2, and 4 are all things that we could expect with a 14-week-old client. We could expect them to have that blink reflex as their eyes are developing and they're starting to have more clear vision. So when something comes closer, their depth perception is to protect their eyes and create that blink reflex. Option 2, tear production occurs with crying. Again, something we expect. Very sad, but yes, their tears are starting to come with their crying, and they're crying for a real reason. And then option 4, can focus on image 8 to 10 inches. Again, that's with their vision starting to fully develop, and now they can track with images 8 to 10 inches away from their face. Usually still not in full HD definition color. Sometimes the color definition doesn't develop until a little bit later, but that 8 to 10 inches, they can start focusing on images and blobs and all of that. So good job, guys. Next question. The nurse is teaching a parent of a 3-year-old client about expected childhood growth and developmental milestones. Which of the following information should the nurse include? Select all that apply. Are we talking about parallel plays, ties shoelaces, feeds self independently, follows 3 consecutive commands, and speaks in 3 to 4 word sentences? Let me know what you guys would think a 3-year-old client would be able to do. Let me know down in the chat. and we'll go from there. Let me also there we go. So, Miss Kunta Kitty on TikTok just passed her NCLEX on Monday. Congratulations. Welcome to the RN world. And thanks for still tuning in to keep that knowledge going and practicing. Good job. Congratulations. Anyone else, any recent NCLEX passers or anybody that recently scheduled their NCLEX or already scheduled it way back when and their test day is coming up soon? I would love to give you a shout out of congratulations or good luck. Get those endorphins going. Let's see. Fiola on TikTok passed hers last week Wednesdays. Congratulations. Anna on TikTok passed hers July 13th. That is amazing. Congratulations to you guys. Someone is still verifying documents. I know the feeling. Pressure P on TikTok takes hers next week. Good job with correct answers. Love on YouTube is taking theirs on August 2nd. That's next week. Good luck. Or actually, that's this weekend. Good luck to you. Good luck, good luck. Lots of correct answers. Good job, guys. Let's get back to the correct answer for this one, which would be options 1, 3, and 5. So the question is stating, which of the following information should the nurse include with the teaching of a 3-year-old client? So a 3-year-old milestone. What can you expect? So kind of imagine a 3-year-old in that toddler phase, still needs help with some things, but they're usually trying to seek that independence and do things by themselves. So the parallel play. So they can play by themselves with the objects in front of them, but they also do well with playing with someone next to them and playing with them with a combined activity. So that's that parallel play. They're starting to interact with the kids next to them and play together. Option 3, feed self-independently. They have learned and seen from their parents or their surroundings how to eat and do that hand-eye coordination. So now they're able to feed themselves independently. Whether it's messy or clean or not, that's a different story, but they're able to start feeding themselves. And then option 5, speaks in 3 to 4 word sentences. This is when we're starting to string together those words to do those small basic commands like I need help, I want food. It's still short, concise words, but you're able to create a full sentence to fully understand what they mean. Instead of just the command of stop, food, help, they start putting more words together. So we would not expect a 3-year-old child to be able to tie shoelaces. It requires a lot more hand-eye coordination, the pincer grasps, and a lot of dynamics. So tying shoelaces is not expected for a 3-year-old client. And then option 4 follows 3 consecutive commands. Again, a 3-year-old is not expected to be able to follow usually more than 1 command at a time. They forget multiple things. I think adults can't follow 3 consecutive commands at a time. So expecting a 3-year-old child might be a little astronomical. So it's not expected for a 3-year-old child. Good job. Next question. The nurse is teaching the parent of a 4-year-old client, so a little bit older this time, about nightmares. Which of the following information should the nurse include? Option 1, fully awakening typically follows a nightmare. Option 2, children often have no memory of nightmares. Option 3, allow the child to self-soothe before intervening. And option 4, nightmares take place in the early hours of sleep. Let me know what you guys think in the chat. Good job. Good job. Someone asked, do they give partial credit for all select all the apply questions? This is true, yes. Nowadays, you select all the apply questions only can help you, which is very beneficial. So you get that partial credit for choosing the right answer, and you don't get any discredit for choosing a wrong answer. So it's only going to increase your score. Whereas back when I took the NCLEX, if you picked the wrong answer, I would get dinged for it. So it's only going to help you if you choose the correct answers or incorrect answers. It's only gaining points for you. Someone says, I have a 3-year-old and still got this wrong. It's okay. Children develop at different strides, I guess. But for the most part, commonality with the different age groups is a little bit tricky to understand. But as you practice and get a good understanding, it might come a little bit easier for you guys. I always think developmental milestones in general are pretty hard. I'm seeing a lot of 3s and 1s, some 2s. So with this question, we're looking at the characteristics of a nightmare. And then on the contrast, we're looking at different things compared to a sleep terror. So a lot of the other options are describing something that might happen with a sleep terror, but option 1 is the only thing true for a nightmare, which is full awakening typically follows a nightmare. So a nightmare happens when you're in the REM cycle, that deep, deep, deep sleep. And in order to get into that deep sleep or come out of the deep sleep, you have to have that full awakening. Sleep terrors is usually during the early part of your dreaming and sleeping when you're not in that REM cycle just yet. So option 4 is describing a sleep terror. Nightmares take place in the early hours of the sleep. This is not true. Sleep terrors can happen in the early hours where you're still kind of aware of your surroundings and what might be happening. Like you might be hearing door closing on the outside and that might be incorporated in your dream. But a full nightmare happens at that REM cycle. Option 2 is incorrect. Children often have no memory of nightmares. This is incorrect because they usually have very vivid memories of these nightmares. And that's where those monsters and scared of what's under the bed or in the closet comes into play because they remember those nightmares, which is pretty unfortunate. And then option 3, allow the child to self-soothe before intervening. This is not a good comfort measure for the child. We always want to soothe them, especially for a nightmare. Even myself, I would want to be soothed having a nightmare to kind of just put yourself back at ease so you can be able to go back to sleep and not be afraid to sleep. So option 1 is the only one that is fully true about nightmares the entire time. Full awakening follows a nightmare. Good job. Question 4, the nurse has taught the parent of a 13-year-old client about adolescent growth and development. Which of the following statements by the parent would indicate a correct understanding of the teaching? Select all that apply. Option 1, my child may experience a decline in self-esteem. Option 2, rapid growth is expected in early adolescence. Option 3, friendships with the same sex are more common. Option 4, my child will have a stable mood. Or option 5, full emotional detachment from the family is expected. Let me know what you guys think in the chat. And make sure to follow us on all your favorite social media platforms so you can stay in the know when we have question drills, question of the week, question of the day, concept maps. We have put out a lot of free resources for you guys to study and stay in the know with your NCLEX and testing yourself. So follow on all your favorite social media platforms. TikTok, Instagram, Facebook, YouTube, so you're constantly being fed good information to keep you with your NCLEX practice. So it says that they have their UWorld subscription. Great. I love to see that, and I'm glad you're using UWorld because it's going to help you so much. Good job. We got a lot of good reasoning in the chat as well, which I always love to see. So we're looking for expected findings for a 13-year-old client. So think of those early teenagers. I know teenagers nowadays aren't the same as teenagers back in the day, but those early teenagers, what can you usually expect with early teenagers and how they interact with their peers, their family? Let me know in the chat. Someone asks, for SATA, does it mean regardless of whether I choose the wrong answer, it will not be deducted from the correct one? Yes, that is true. So even if the correct answer is 1, 2, and 5, if you choose 1, 2, 3, and 5, you won't get knocked off for choosing that 3 as well. So it's only working for you. Correct answer is 1, 2, 3, not 5 for this question. So we're thinking about typical things that you can expect from a 13-year-old client. So a preteen or a teenager, actually, in this case, they're usually going to have a decline in self-esteem. When they're in that early teenage years, or they're going through puberty, a lot of changes with their body, maybe a lot of things with their environment, maybe going from middle school to high school or changing scenarios. They're having a lot of peer pressure and comparing themselves. So they might experience that decline in self-esteem because they might be comparing and getting used to their new body, their new environment. So that is expected. Option 2, rapid growth is expected in early adolescence. Again, during that puberty phase, which is usually happening around 13, they are going to have that rapid growth and have that growth spurt per se. Option 3, friendship with the same sex are more common. This is true. We like the girls to be with the girl, or not like. The girls usually hang around the girls and the guys usually hang around the guys because they want that commonality to raise their self-esteem and make sure that they're growing at the same rate and that they're alike with all their friends. So you usually see the same sex friends with the early teenage years. You usually start having different sex friends a little bit older, like in the late teens to early 20s. Option 4 and 5 are incorrect. Option 4, my child will have a stable mood. Let's be honest. Do we know teenagers as being stable with their mood and emotional things? They're going through, again, a lot of changes. So expecting them to have a stable mood, it would be the exact opposite. You're open for disappointment at that time. Option 5, full emotional detachment from the family is expected. This is actually not true because that 13-year-old still needs help with maybe getting their food and money and transportation. They're going to rely on their parents and their family for a little bit longer. You expect some detachment maybe around 18 or when they're like out of the house and a full adult, when they're trying to separate from the family, maybe go to college or moving out of the house, but not that full detachment at 13-year-old when they still rely on a parent or some type of guardian for food, housing, money, and all that stuff. So good job, guys. Next question. The nurse is planning care for a 3-year-old client who is hospitalized. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. Option 1, maintain the client's home routine as much as possible. Option 2, demonstrate medical procedures to the client using a doll. Option 3, ask the patient to bring the client a comfort item from home. Option 4, use medical terminology when describing procedures to the client. And option 5, encourage the parent to remain with the client as much as possible. Let me know what you guys think in the chat. Good job, guys. And we are past halfway through, and I feel like we got a good bunch, a good chatty bunch in the chat, which I always love. But I get to ask my favorite question. Where are you guys tuning in from? I love to see how far you world reaches in the world, whether we are more domestic in this afternoon time or more international. Let me know where you viewers are watching in from. Let's see what my first one will be. Virginia Beach, Virginia. Kenya, California. We have a Cuban watching from Miami, Nigeria, North Carolina, New York, Los Angeles, Houston, Maryland, New York, Toronto, Texas, Bridgeport, Connecticut, UK, Wyoming, on vacation in Jamaica, and you're watching us. Kudos to you. Brownie points to you. Wisconsin, Seattle, Mexico, New Jersey. I'm from Ohio. I'm not even a nursing student, just curious. Love that. Thanks for tuning in. Future speech therapist. Love that, Rebecca. Georgia, Brazil, Tampa, H-Town, Rochester, California, North Virginia, Brazil, Nepal, Saudi Arabia, Lots of people all over, whether it's international or domestic. I love to see it, and I love to see you guys chatting in the chat and not being afraid to let me know where you're from. It's so good to see how far we reach every single week. Someone said, I just graduated from my nursing school, ready to take my NCLEX for RN. You go, Miss Yassi. Thanks for tuning in. Okay, correct answer for this one is options 1, 2, 3, and 5. So we're planning care for a 3-year-old client and they're in the hospital. So the main thing with this one is basic comfort and safety. You want to keep them comfortable, you want to keep them safe, and the easiest way to do that is to provide their environment or try to make their environment as what they're used to. So option 1, maintain the client's home routine as much as possible. If you can mirror their schedule or their environment, whether it's like their bedding or their schedule on what they eat and what time they eat versus like a bath, like eating before dinner time or showering before dinner time. Mimicking their normal home routine makes the interventions that you might have to do a lot easier. So that would be a correct intervention or teaching. Option 2, demonstrate medical procedures to the client using a doll. This will again help ease their anxiety and make them more comfortable with whatever is going on in the hospital. Showing them what exactly is happening because they're more visual learners, because they don't have that broad vocabulary, especially with medical terminology. So if you can show them what you're going to do, it will help ease their anxiety and not have that fear. Option 3, ask the parent to bring the client a comfort item from the home. This is good. Everyone loves a good teddy bear or a blanket that they love and dear so much to kind of also ease their anxiety about whatever is happening. And then option 4 or 5, encourage the parent to remain with the client as much as possible. Again, it's another comfort measure for them. If they don't have that stuffed animal or a blanket, a parent is always a good comfort measure. Option 4, use medical terminology when describing procedures to the client. Excuse me, this would be an incorrect thing. This would increase their anxiety because they don't understand that medical terminology. They don't know what's going on. So this would actually be the exact opposite from option 2, demonstrating using a doll. We want to put it at their level that they would understand, so it's easier to do the interventions and they feel comfortable with you and whatever is going on. So that would be the incorrect option. But good job, guys. Question number 6. The nurse is screening pediatric clients for autism spectrum disorder. It would require follow-up if A, blank. Option 1, a 9-month-old client has not developed a strong pincer grasp. Option 2, 17-month-old client cannot kick a ball. Option 3, 24-month-old client lacks spontaneous eye contact. Or option 4, 36-month-old client cannot hop on one foot. Let me know what you guys think in the chat. Good stuff. Someone asks, is this questions for PN or RN? These are questions geared for RN. We do have the PN subscription and UWorld information, but we just don't cover it with our lives. All of our lives are RN targeted. Good job, good job. This one seems like a good, easy one for you guys. It's pretty unanimous in the chat, which is option 3, that 24-month-old client lacks spontaneous eye contact. This is, just one of the things that we look out for developmentally wise when screening for autism spectrum disorder. So at 24 months or 2 years of age, if they are not maintaining eye contact, especially when you're talking with them, this is geared towards autism spectrum disorder. If a client, option 1, 9-month-old, has not developed a strong pincer grasp, this is not to be concerned just yet. 9-month-old is pretty early for them to get that pincer grasp. They have a lot of that palmar grasp. They're just grabbing everything, grabbing your earrings, your hair, everything. Option 2, 17-month-old client cannot kick a ball. Again, not expected for a 1.5 plus year old to be able to kick a ball. That requires a lot of foot hand-eye coordination, as well as a lot of balance. Same with option 4, that 36-month-old client cannot hop on one foot. That's a lot of balance for a 3-year-old to be able to do. If they are, they're exceeding, but we're not expected to see a 36-month-old client hop on one foot. But we are expected to see a 24-month-old client give you eye contact. So if not, maybe start screening for autism. Question 7, last question of the day. The nurse is assessing a 2-year-old client. Which of the following findings would require follow-up? Option 1, walks with assistance. Option 2, identifies 2 body parts. Option 3, uses a spoon during meals. And option 4, speaks in 2-word phrases. Let me know what you think in the chat. Also, let me know how many questions out of 7 you guys got right today. I know developmental milestones is pretty tricky. There's a lot of different milestones, a lot of different ages. So it's okay if this one was a little bit harder for you today. But let's see how you guys did. And a lot of correct answers. Good job, guys. If you want to see what we're covering next week or even this weekend with Nurse Andrew, tomorrow at 7 p.m. or Sunday at 7 p.m. with Nurse Andrew, you can check out our website at uworldnursing.com to see our full event calendar, where it shows what days we go live, what topics we're covering, whether it's a lecture, question drill, and then as well as you can see our social media page, whether it's TikTok, Instagram, we post these afterwards, and then we also have other things like question of the day or concept maps or just funny videos that we post on our social media page. So make sure to follow, like, comment, subscribe, swipe up, just kidding, all the things. Good job, guys. Good job, good job. Okay, I'm seeing a lot of 1s and 4s. So we're looking for, this is a negatively worded question. So we're looking for an abnormal finding. So if a 2-year-old client is doing one of these, which one would be concerning? Maybe that will help us with the correct answers. I see someone saying, okay, switching my answer now. Yes. If a 2-year-old client is requiring assistance while walking, this would require follow-up and intervention. Like, why do they still need some assistance while walking? We would maybe want to do some neurological checkup and make sure that everything is okay. They shouldn't need assistance while walking. But a 2-year-old client should be able to identify 2 body parts. They should be able to use a spoon during meals and help feed themselves. And they should be able to speak in 2-word phrases at least and piecing those command words together. So those are expected things. But if they are walking with assistance, that would be a little bit more concerning. So this one is a little tricky with the wording. Require follow-up means we're looking for an abnormal situation or intervention. So walks with assistance is abnormal for a 2-year-old client. But you guys did pretty good. It was pretty tricky today, but I think y'all actually did very, very good, which is always good to see. Thank you so much for tuning in. I hope you learned something. If not, just come back again and you can always learn some more. I hope that you can check out Nurse Andrew tomorrow at 7 p.m. as well as on Sunday at 7 p.m. If not, I will see you guys next week. Take care.